Routine shoulder. Let's say we're doing a right shoulder. She's shielded. All right, central ray is 1 inch below coracoid. Can you feel coracoid? No, there's no such thing as feeling it. So a little step to your left. You must include, I think I forgot to mention this the other day, but now you remember, you must include 2/3 of the clavicle on shoulder x-rays. So if we look right here and we have light above her shoulder and on her arm, there's the medial end of her clavicle right there. So come just a little bit towards me, right there. So there's some light beside her. There's light above. That's good. So this is a right marker, although it's a left.
Light is screwing up the light.
Yeah.
All right, so we're going to take her hand and we're going to turn on external rotation. That's a 10 by. And we're going to say, hold your breath. Beep. And we're going to change our cassette. And we're going to turn it in so that the epicondylar plane is perpendicular. Hold your breath. Beep. There's a shoulder. Questions?
That's it?
Yeah. That's it. That's a routine shoulder. That's what they did with you, right? But then they did the Y view also.
They did that one, they did a PA, KP, and a lateral.
Because there was only 3 on there. So it was internal, external, Y. We'll look at them. Okay, so now Y view's by itself. I'm going to say now that we're going to do her left Y view, just so that you can see it. There are 2 options to do a Y view. First of all, we're going to put our light the other way. Because think of your scapula, is it longer or wider?
Longer.
Your scapula is longer, so we want the longer light field. So say right now, I'm going to have this arm across your chest, across your belly, sorry, just like that, because it's in pain. And I'm going to turn. All right, what we're trying to visualize here, sorry, is imagine right here, if I had her perfectly lateral at 90 degrees, are her scapulas right on top of each other?
Yes.
Yes, so she's at 90 degrees. So this is the shoulder I want to look at. So all I'm really doing is taking this scapula and just kind of shoving it out of the way so that this one is by itself. And then the central ray is on the scapulohumeral joint, which is right there.
This is the one that you can have the 45 to 60 degree.
45 to 60 degree angle. And she looks pretty close to 60. But I've just taken this scapula, which right now, if my hand feels perpendicular to the IR, then that means it's the scapula is in what position? The scapula is in a lateral position or perpendicular to the IR.
Okay.
Now see this central ray right here, this crosshair? That's where I'm trying to place this scapula is right in that crosshair. So if I have her come backwards towards me, does it look like it's in that crosshair right there?
Mm-hmm.
I'm moving, patient. So that is now perpendicular to the IR. Okay? Another way you can do it, this is an AP projection. You can also do a PA projection. Does that look like the same thing?
That looks crazy.
Look, there's the crosshairs. There's her scapula right in the crosshairs. See my finger?
Yeah, but
That's
look
right
at the
there.
light field on her back.
Yeah, you can't even look at that. It's completely distorted. Where it's supposed to be entering is right there. So she would be like that. See that crosshair right there? This is placed right inside. It's very superficial. So does it look like my hand's going to hit right in there right now?
I can't even get that on video.
So what you really need to do is just take her humeral head.
Serious.
It looks weird, and you're going to try too hard, and you're going to call me in and go, I don't know, is this right, is this right? It's that easy. You just don't try so hard, and it works out.
Yeah. You're
All right,
gonna have
Dario's
to
got
die.
a
Serious.
spotlight.
Jesus.
So you're pretty much guesstimating then.
You're guesstimating, but
Okay.
again, look right here. My scapulas are right on top of each other. I need to see this one, so just take this one and shove it out of the way.
That would
And
be
now
weird.
this one is hitting there. I'm just kind of getting that scapula and saying, get out of the way. And now I'm putting this one on there. That's a Y view. Easiest thing is the patient comes in, arms across the stomach, she's in pain. I just have her turn, turn, turn. Put this humeral head right on the center of the IR, and that's a Y view. The more you try, the worse it gets. Right now, I'm just putting this against the IR. Okay?
Okay.
You'll ask me 100 times to show you that again.
I probably will. The light field's missing.
Uh-huh. It's confusing. It's distorted. Very distorted. What's next?
Because we're not comping on the neutral and we're not
Right.
comping on non-trauma warrants.
Right.
The next is special shoulder, posterior, oblique, glenoid cavity,
Okay.
gray sheet.
This is the one that's so super duper easy, you're gonna think you're doing it wrong. The other one's so super easy, but it is. All right, so here's that squishy part right here, which is the scapulohumeral joint. So I'm gonna have her step just a little bit to your left.
And you still keep your cassette long.
This one, it doesn't matter because you're gonna go like this,
Oh.
so it doesn't matter.
These light fields are crazy on the patient.
That's it. Arm does nothing.
It just,
Yep.
like
She's rotated 35 to 45 degrees to make the scapula parallel to the IR, and the central ray is entering at the scapulohumeral joint, and the arm is just in neutral, slightly abducted. Hold your breath. Beep.
the next
great
one is the Fisk tangential inter.
All right, we'll save that one to the end because it's the only one on the table.
Special shoulder, transthoracic, lateral, trauma warrant.
Okay, so we knew how to do that one because we did it with the other one. Let's say her right arm is injured. So this is a right marker in the light field. I'm gonna have her turn, put your right arm against the IR. Now remember the other one when we did it, it was for the entire humerus. This is just for the shoulder. So our central ray enters on the surgical neck. Come forward a little bit. Now you notice I'm not having to move these vertically any because we're all in the same area and it was set to her height at the beginning, so it's just kind of there. Does that look like it's hitting the surgical neck?
Mm-hmm.
Yep. So now we're gonna do a slight anterior rotation and we're gonna bring this arm up over your head,
And her affected arm is against the IR?
just like the other transthoracic. And I'm gonna tell her breathe normally. Beep. 2-second exposure. Does that look like the other one? The other one we had this light field. This one we have this light field. Just for the shoulder. But it's the same thing. What's next?
Routine clavicle.
Okay. So clavicle, say we're doing her right clavicle. Is your clavicle wider or taller?
Wider.
Wider.
So we're gonna do this light field. I have to get her SC joint and I have to get her AC joint. They're definitely both in the light field. I want the central ray mid clavicle. So I'm gonna push that up so that it's mid clavicle. Look a little cockeyed sensor. There you go. Kind of falling down. We're gonna show a little bit of collimation. And now I'm gonna tell her take a deep breath in.
Ooh, and it moves.
Hold it. Beep.
And you want it to raise?
You're trying to raise the clavicle. That's why you do this on inspiration. Okay. Now we need to do the axial. Change the cassette. It's 15 to 30. She is not astenic. She is not hyperstenic. So let's go with 18, just for fun. So there's about an 18. And now we're going to put the central ray right back where it was. That clavicle. Don't forget to realign that.
And that's also to remove the clavicles out of the way.
Yep, to get it out of the lung field. Take a deep breath
That's
in.
almost like the Madonna.
Hold it. Beep. Breathe.
Yeah,
It's the same thing.
Yeah.
You're just concentrating on that
But
clavicle.
without them going like that. I'm sorry.
Yeah.
No, you're fine.
Well, this is more like the AP semi-axial, right?
Okay.
We angle it too, but it does the same thing. That's a clavicle.
Routine scapula.
Okay.
You want routine AC joints first?
No, because that's 72. All right. So, again, your scapula is longer than it is wide. So we've got our light field going up and down. I want to put my central ray on mid-scapula. There was a cheat for that.
2 inches of their armpit.
Armpit should be
Sorry.
mid-scapula. And we're there. Now, if I wanted to check to make sure I had it, I can turn her around. Put your arm behind your back like that. There's her scapula. Am I in the light field?
Yes.
Yes. So now I know that I'm good. So I'm going to turn her around, put her back up against there. I'm not going to move it vertically again, so I'm going to go ahead and line that up. And now we need to do something to remove her scapula from some thoracic structures.
Raise your arm.
We're going to abduct 90 degrees, and then we're going to supinate. Supinate.
Salute.
We should be about halfway between there and there. Teeny bit to your left. Perfect. Okay, breathe normally. Beep. 2-second exposure. Now we need a lateral of the scapula, so we're going to do it exactly how we did the Y view, except one thing changes. What changes? Before we wanted to keep the olive in the glass. Now we want the olive just out of there. Get it gone.
How do you, oh, across.
Remember that thing?
Yeah.
Okay, so now she's going to take this arm. We can choose to do it this way, AP, or I like better. Nope, arm was right. Oh, sorry.
She's like, no.
There's PA.
Why do you like that better?
Less OID. Just think about the scapula where it is.
Because you want her right.
We're doing her right scapula, and that's just so much less OID than it is over here.
Holy cow.
Yeah. Now let me show you a trick to not screw yourself up on this, because I've seen it happen lots. When she's standing like this, and you know that you are doing a right scapula, put your hands on her scapula and concentrate on your right hand and say, I've got to get it perpendicular to the IR. That way, if you turn her this way, you're like, wait a minute, that hand's not perpendicular. And then you'll go back like that and go, okay, now it's perpendicular. Or, now it's perpendicular. Light, light. Right there. That's a lateral scapula.
We can't look at the light field on her back.
No, you can't look at the light field. I know that the light is centered, it's in transverse detent, and I'm putting her humeral head right in the center there, and I'm getting this scapula out of the way. Again, look from your view. Superimposed scapulas. This one's in my way. I don't want to see this one. Get it out of there.
So it doesn't take much.
Yeah, because I mean you're at 90 and you want to get to 60, so that's hardly any at all. It's only a 30-degree turn, which is not much. Okay.
Okay.
All right, AC joints, flat against there. This is the only one in the class.
72.
72. Now we're going to do something weird on here. Weird, weird, weird. Most doctors want the same on the same cassette. What are we, 12, 14 inches, yes, 14 inches. They want it on the same cassette, yet in the bucky. How do you do that, you ask? Okay, you step up to the side. So we wanted to put two pictures on the same cassette. So we have the light field this way. I want to split the cassette here. So what size should our light field be?
Very small.
It should be
longer than it is.
It should be 14 by 17, but I only want to use half of the cassette, so we should split that 14 in half and make it a 7. So, okay, come on in, patient. So she's going to stand. Our central ray is 1 inch above jugular notch. For short arm people, this is tough.
Oh, great.
1 inch above jugular, a teeny bit to your left.
Can we bring like a little marker and just dot her neck?
All right, now the only thing is when I see this on her and I see that it's 1 inch above, I see right there, I'm not hitting the AC joint. So that 1 inch above, I don't know if it really, Here's her AC joint right here.
Right.
That's what I want to hit. So 1 inch above, okay. Now I'm going to just use the top half of my cassette. You see how I'm doing that?
Mm-hmm.
Just using the top half.
See, and to me it seems like it would diverge below the bottom half.
It doesn't. It's
okay.
weird. It doesn't do it. If you don't like it and you can't see it and you want to check yourself, take it out to detent. Only on the top half. Don't forget to put it back in detent. Okay, so now I'm going to tell her, hold your breath, beep, don't move. Breathe. Yes, breathe, but don't move. Yes, thank you. Then I'm going to give her these at the exact same time and tell her to let him pull his shoulders down. It's always scary letting go like that. And then what do I need to do?
Where's the cassette?
Raise it.
To the other half.
Bottom half of the cassette.
And you don't have to use lead masking or anything. It just
That whole scatter thing. Now, when we learn about scatter, it's on a big scale. It's really on
How many people pull this income?
You'll like to. It's easy.
That's what I'm saying.
Yeah.
I want this.
And then I just tell her, hold your breath, beep, breathe.
So that's the whole series?
Yep. One without weights, one with weights. That's it.
That's cool.
Too easy, huh?
You should put 10 of those in the hand.
Everyone says. Okay, last one is over here. You lay on your back, please, with your head like that in. All right, this one is specifically looking for what part? Little teeny thing.
The glandular. Which one are you doing?
The bicipital. Well, I said it. The bicipital. Okay, so let's say now we're looking at her left bicipital groove. I'm gonna turn this so I can jam it in her neck a little bit more.
Excellent.
We do not need a grid because this is a tangential, or like going through nothing. All right, so right now I have 0 tube angle, correct?
Yes.
But I need 10 to 15, so I'm gonna go 15. 15 always scoops better. And I need 40 inches. Did I ever tell you guys this stupid thing?
No.
This stupid thing? You'll see techs doing this. To them, this is 72 inches, and this is 40. Now, we know that everybody's arm span is completely different, but you'll see them go, looks about 40. So I'm looking, I'm going from here to here. Yeah, looks good. It's a guess. Now, I need to get my central ray right there on her bicipital groove. So this is when I said, shield the gonads so that you don't chop somebody. See this deli slicer right here?
Oh,
Yeah. Looks like a deli slicer, doesn't it? So I've got to get my central ray down on her bicipital groove. So I'm watching, watching. And Wanda's got some boobage. So I'm going to ask you to take your right hand, grab your left breast, and yank it over there. This is real. You really have to tell people to do this.
Is that enough?
Okay, here's what I'm trying to hit right here. Remember how when we did that gainer heart, we said, there's my central ray. I want to make it disappear. Does it look like it's hitting my finger? It's a guess, but looks like it's hitting my finger, right? So I'm going to go, yep, looks good to me. And then the most important thing, hand must be supinated. Now it looks like my central ray moved a little bit, so I need to get a little bit more in there. There we go.
What about her fingers in the light field for her boob?
Can't help it. It's not hitting the part that we need to look at.
Okay.
Can't do anything about that.
So this actually got to move that close to the patient.
Yeah, because you've got to get 40 inches.
I was wondering what the deli's.
Yeah, there's the slicer.
That's like
So-
in her leg.
Beep. Yep. Now, if you can let go of your boob. If you had to, what could you do if you still couldn't get it down low enough?
Is that the
Critical thinking. What could you do? You can't get the tube lower, but you might be able to
Change the angle?
build her up. Now I've got it at 15. That's as much as I can do. So I could get a little sponge and kind of jam it under her to lift her arm up.
Okay.
To do that if you need to.
Would you just build her arm up, or would you have to like make sure the whole back was up?
No, because just think what you're looking at is just that humeral head right there. If that humeral head is up, you can see it. You want to see it built up? You want to see what it looks like? On her it works, but I can't figure out like if it's someone that's larger, smaller, or what makes it change, but it's all work. But even if I just took this, okay, lay back down, and built her up there. Yep, get the boob, arm, there. See, now I've got more room to hit right there, and I'm not quite down on her as much.
So we could use that.
Mm-hmm.
if we
Do you
wanted to?
recommend it?
If the patient's in pain, you know.
So you really have to have that cassette kind of jammed in their neck?
Yeah, you have to have it in her neck, because even now it's going to be way over there, but I could put it a little bit more, but that's getting uncomfortable.
Okay, now I think this would
Wanda's
be more
eyes.
something better calling for because of the way.
I don't want to it's cockeyed a little bit.
What, this?
Yeah.
Yeah, we're like that.
We are like that.
And look at the picture in your book of this, the x-ray of it. It's literally, you're looking at something smaller than my fingernail. It's just doop, that little teeny groove is what you're looking at. And it's right there where my finger is. So I'm just kind of guessing, here's my finger. Looks like I'm penetrating right there because I'm touching it.
Mm-hmm.
It's a guess. If you did this,
You would miss it.
it'd probably be in the picture, but it would have to be excessive technique to be able to pick that up. because you're hitting nothing in your central ray. So I'm just kind of touching and I'm going, there it is. I'm guessing my finger.
So just
Yep.
disappear.
Yep.
And do not look at the light field on the patient.
Right. Doesn't work.
And you definitely can't see that on the patient anyways.
All right, we'll let you up. That's it. And that's for Thursday.